Thank you very much. We might as well spend a bit of time on the good news. Isn't that right? I move the motion. The motion, the bill now be read a second time. I'm really pleased to be introducing the bill today, the Health Miscellaneous Provisions No. 2 Bill 2022. First of all, I'd like to acknowledge that the title of the bill has changed in recent days, and this is reflective of the core purpose of the bill being expanded. We're expanding it from solely abolishing inpatient hospital charges for children, and subject to my bringing committee stage amendments next week, will also encompass provisions relating to the introduction of a free contraception scheme, which will have a very real impact on sexual and reproductive health and sexual and reproductive rights in our country. And can I acknowledge and thank the Health Committee for agreeing to waive pre-legislative scrutiny for the bill. The programme for government sets out the pathway for expanded access to healthcare in keeping with our vision of universal healthcare. We promise to expand universal access to healthcare in a manner that is fair and that's affordable. We have delivered this, and we're continuing to deliver on that commitment. The measures being introduced as part of this legislation are very much intended to support access to care for those who need it. I'm very conscious of the current financial pressures on families, and it's something I'm working to address in health. Budget 2022 announced the introduction of a range of affordability measures in health, which are intended to ease the financial burden being experienced by many families. These include increased funding for new medicines, a reduction in the amount people pay for their medicines through the drug payment scheme, sustainable funding of the dental treatment service scheme, and abolishing inpatient hospital charges incurred for children accessing care in our public hospitals. These measures are intended to help more people access affordable healthcare, and I'll provide more detail in a moment on the progress we're making on these objectives. Firstly, I'd like to focus on the immediate objective of abolishing public hospital inpatient charges for children. Better access, together with affordability and improved quality, are among my top priorities. This legislation will ease the financial burden of parents and of guardians when bringing their child to hospital for inpatient care. It'll help to ensure that cost is not a consideration for families when children require access to inpatient treatment. Currently, public patients, including children, are subject to a statutory charge. It's an acute inpatient charge. It's €80 a day, up to a maximum of 10 days, or up to a maximum of €800 a year. Medical card and other certain classes of persons are already exempt from these charges, but I think, Ceann Comhairle, and I think colleagues would agree that for a parent bringing their child, or for a guardian bringing their child into hospital, they're already dealing with a very stressful situation for their child, for themselves, their family, and the idea that coming out of hospital, they'd be landed potentially with a bill for €800 for the child's stay in hospital is something I think we can all agree is something that we can consign to the dustbin of history. And that's exactly what this bill is going to do. I'd like to now provide a brief explanation of the sections of the bill. Section 1 contains standard provisions setting out the short title citation and provides that the bill will be subject to a commencement order. Section 2 amends Section 53C of the Health Act 1970. Section 53C provides that charges shall be made for acute inpatient services provided by or on behalf of the Health Service Executive. Subsection 9AA confirms that the €80 public charge is not applicable to persons who've chosen to avail of private acute inpatient services under Section 55 of the Health Act, in which circumstances the more significant charges set out in the 4th schedule appropriately apply. In other words, there are situations where hospitals will offer private facilities or to provide the same healthcare, but to provide it to the child as a private patient. And those charges can range from over €800 to over €1,000. And what we're saying is, well, of course we will be abolishing the public charge, which is €80 for public patients. If parents opted to avail of private facilities and private care, we would not also be paying €800 or €1,000 per night for those. And I hope, we look forward to hearing the contribution, but I hope that's something that colleagues will agree with. Subsection 9BB provides for the exemption of a child up to the age of 16 years of age arising from acute inpatient services, and the bill also provides that under Section 2C and D, The existing inpatient charge exemption provision for children will not be impacted. The effect of these amendments is to remove the acute public inpatient charge of €80 per day for children less than 15 years of age in all public hospitals. I'd also like to take the opportunity to update the House regarding a committee stage amendment that I'll be proposing to bring to the bill. Following government approval earlier this year, I propose to amend the bill to introduce the legislative framework to support the introduction of free contraception, starting with women aged 17 to 25. Obviously, we want to roll it out further and further, as laid out in the programme for government. It makes sense from a practical perspective to introduce the contraception provisions into this bill, as both policy objectives relate to reducing the cost burden while accessing healthcare. The proposed committee stage amendment that I'll bring ensures that the contraception scheme can be introduced at as early a time as possible to ensure access for women aged 17 to 25, and the scheme is due to be launched in late August, early September. The scheme will be open to all 17 to 25-year-old women ordinarily resident in Ireland. It will cover the cost of medical appointments to discuss and prescribe suitable contraception. It will cover the cost of fitting and removing of long-acting reversible contraception, for example, implants and coils. It will also cover the cost of any necessary checks and checkups. It will also cover the cost of a wide range of prescription contraceptives currently on the reimbursement list and available to medical card holders. This includes contraceptive injections, implants, intrauterine systems and devices or coils, the contraceptive patch and ring, and various forms of the pill, including emergency contraception. In other words, Ceann Comhairle, the question has been raised quite rightly: is this just covering part of the costs of access to contraception, or is it covering it right through, from meeting the GP, from the devices themselves or the medication themselves, the prescription, and going back to the GPs for checkups and so forth? Will it cover all of that? And the answer is a very clear yes, it will. It's to cover all of the costs and associated costs of contraception. €9 million is allocated this year to support the rollout of the scheme, which represents a really wonderful opportunity to increase access to contraception and to better support sexual and reproductive healthcare and gender equality in Ireland. There's a strong rationale for introducing the scheme, commencing with 17 to 25-year-olds, in line with the programme for government. With regard to this specific age cohort, the scheme will reduce cost barriers to effective contraception and crisis pregnancy rates amongst the highest risk, or the high-risk cohort, many of whom, for example, are still in full-time education and are least likely to have independent sources of income. Introducing the scheme for 17 to 25-year-olds will also allow for expanding health service capacity by training more medical professionals to fit and remove long-acting reversible contraception, such as the coil, and monitoring the operation and costs of what essentially is a demand-led scheme. Free contraception is enthusiastically supported by stakeholders, particularly clinicians and others working in the area of women's sexual and reproductive health. Given that the costs of prescribing contraception are typically faced by women, the measure will have a significant positive impact on gender equity, reducing costs for women and also benefiting, obviously, their partners and families. The scheme will reduce costs to this vulnerable age group who are not eligible for a medical or a GP visit card. We know that analysis in other jurisdictions has concluded that free contraception is a cost-effective measure. It is, as the Irish Family Planning Association pointed out, a landmark development, and I hope to roll out this scheme in a way that it is accessible for all women in Ireland. And indeed, Ceann Comhairle, I was up on Parnell Street a few months back with IFPA, or the Irish Family Planning Association, and it was a wonderful visit, because they were set up in, I believe it was the 70s, and they were set up directly in response to the impact on women's healthcare of the ban on contraception at that time. And it was wonderful to be able to go up and have a meeting with them about the fact that not only, obviously, is it not banned, but it's now all been made free. And I'd like to acknowledge and thank everyone there for all of the work that they've done, not just over the years, but indeed over the decades, to deal with some of the implications and some of the restrictions we've had in Ireland on contraception, particularly as it relates to women's healthcare. Women's health, as has been discussed, really is a top priority for me. It's a top priority for government. It's supported in this budget with a €31 million additional fund, and in fact the full year cost of that 31 million is nearly 50 million, and the main reason for that very significant increase, in fact, is the free contraception scheme. So we've put in 9 million euro for this year, but in fact the full year cost from memory is a little under 30 million. I think it's 20 something million. It's absolutely the right thing to do, and we've had to allocate a very substantial amount of money to making sure that it carries through. We recently also launched the Women's Health Action Plan, which sets out a very ambitious programme of work, bringing about progress in critical areas in women's health in the country, and it takes a targeted approach to addressing the health issues that affect women's everyday lives, and critically that have been informed by what we called a radical listening exercise. In other words, a Women's Health Action Plan informed by women and what women have said they need and they want in this country. Bearing in mind all of these very positive impacts that will arise from introduction of contraception for 17 to 25-year-olds, I will be seeking the support of the Oireachtas for this really significant improvement in women's health affordability measure. The funding allocated to health for this year in Budget 2022 is the biggest ever investment package in Ireland's health and social care services. It does demonstrate the government's commitment to delivering on universal health care. The abolition of inpatient charges for children and the introduction of free contraception for women are two of several affordability measures that were announced. Taken together, the measures are intended to ease the financial burden being experienced by many families and to help more people to access healthcare and affordable healthcare. We're also committed to increasing access to GP care without charge for more children. It's an important healthcare measure that is going to remove what can be a prohibitive cost barrier to accessing GP care for children and indeed for their parents, and it is going to help improve children's health as we move through this. The budget made available resources to introduce GP care without charge for 6 and 7-year-olds. As of the 1st of June, approximately 2.1 million people, that's just over 40% of the population, do already have access to a GP card or medical card, GP care without charges. And it's estimated that approximately 80,000 children who are 6 and 7 will now, after this, be eligible for a GP visit card as well. So I think it's not everything, but I think it's a really important step in the right direction. And consultation with the IMO representing the GPs, obviously, consultations are ongoing, and the service will be introduced as soon as possible once we've got these negotiations completed. The government is also committed to reducing the costs of medicine and making essential healthcare more affordable and accessible. The drug payment scheme very significantly reduces the cost burden for families and individuals with ongoing expenditure on medicines. This year's budget provided 11.5 million to fund a further reduction in the DPS threshold. For an individual or for a household, it went from 114 to 100 euro a month from the 1st of January, and from the 1st of March, we've gone further to 80 euro a month. And that means that for many families around the country, that's just over an extra 400 euro in cash a year less that they'll be spending on drugs. And via the DPS, it is at least something where these awful inflationary costs, which are causing so much pain for people, the DPS means that those inflationary pressures are not passed on, because ultimately there's only a certain amount you have to pay. So the state may end up paying more, but those increases in costs for the medicines, essentially the citizen is protected from them via the DPS, which is very, very important. While we're talking about new medicines, I'm committed to funding access to new and innovative therapies, and including those for rare diseases. It's clear from from my own analysis of the trend over the last few years that the overriding factor in medicines making it through the process to reimbursement is the availability of funding. In other words, when over the past many years, when there's funding available for new drugs get approved. When the funding isn't available, we tend not to see them approved in the same way. And I'd just like to acknowledge most, if not all, of the deputies here have advocated for different drugs for children, for adults, for rare diseases, for common illnesses through the years. Last year we allocated 50 million euro to new drugs. Now, what were they able to do with that? They were able to sanction 27 oncology medicines, 19 medicines for the treatment of rare diseases, including things like spinal muscular atrophy, which we've discussed here before. And I think that's really important, and I'd be very happy to send a note around to colleagues on the long list. I think it's something as a state we should be really proud of. Obviously, there's an infinite amount that you would like to be able to do, but there's been a very significant increase in the availability of new drugs, and talking to patients, talking to the patient groups, talking to parents, some of these drugs really are life-changing, and it's fantastic. This year we've added an additional 30 million for new drugs. So over the last 2 years, we've sanctioned 80 million euro just for new drugs, and it's having a really, really big impact. And so far this year, the HSE has already approved 30 new drugs, and that includes several drugs, the so-called orphan drugs for rare diseases. In December of last year, the state signed a new 4-year agreement with the Irish Pharmaceutical Healthcare Association and Medicines for Ireland. This was on the supply and the pricing of medicines. It's a very good deal, and I'd like to commend the officials who were involved in negotiating it. The agreements, we believe, can contribute between 600 million euro and 700 million euro towards the costs of medicine over the next 4 years. What does that mean? That means there's more money available, there's more exchequer funding available for new drugs, new ways of tackling rare diseases, new therapies. It's very exciting. Reform of dental services is also something we're committed to, and to align it with the National Oral Health Policy. Work on that reform has commenced. The government and I have been concerned that medical card patients in some parts of the country, indeed in a growing number of parts of the country, have been experiencing problems in accessing dental services, and this is something that has to be addressed. Over the past few years, a significant number of contracted dentists have chosen to opt out of the Dental Treatment Service Scheme. Essentially, that's the scheme whereby the dentists who are private, self-employed or privately employed, that's the scheme whereby they provide services to medical card holders. So to address this problem, I secured an additional 10 million euro for this year to provide expanded dental health care for medical card holders. And this includes, importantly, the reintroduction of scale and polish. So that's something that is available under PRSI, but had been withdrawn for medical card holders. And I think it's important that we have parity there. And I'm delighted to see that back in. Now, as well as that 10 million, I'm also allocating an additional 16 million euro of an underspend to this year's estimate to increase the fees to the private dentists. And if we look at the schedule, the fees really have increased quite substantially because of this. The combined effect of these two interventions represents an additional investment of 26 million euro this year, over and above what was spent in the scheme last year. And I hope that this significant additional investment will attract more dentists back into the scheme. Regardless of the impact it has, we have also committed to a root and branch reform or discussion with the representative body on oral health and a dental scheme that's fit for the future. To conclude, Ceann Comhairle, can I say that there is an awful lot of work underway within my department to advance the objectives of affordable healthcare. There is a range of really good policy measures which are either already implemented or they're being finalised, and indeed this bill today speaks to exactly that. This is the legislative basis for 2 of the affordability measures which we have committed to. I believe that the provisions of the bill, in conjunction with the other health affordability measures that are being developed or that are being deployed, will help more people to access healthcare and will enable more people to access affordable healthcare. The cumulative effect of the measures, really, which is what matters, will help mitigate the financial pressure people face and ensure the cost is not a significant consideration. Indeed, cost should not be a consideration when people need to access healthcare. This includes access to hospitals for children in this bill, and it includes access to contraception, which will be in this bill via committee stage amendments. And so can I thank again the Health Committee for waiving pre-legislative scrutiny, and I look forward to today's discussion. Gur Mágat.